course, we have another case up for you here. We'll start off with question 1. We'll put 2 minutes on the clock, and your time starts now. All right, time up. And I don't know about you guys, but we have had a lot of these kinds of cases at my clinic recently, which is why I thought this would be a fantastic question for KFP preparation. So again, going back to environmental or occupational medicine, it's all about what kind of exposures does this person have. Now, of course, we have things like exposure to pollen or grass is a very, very common trigger. And so anything around that kind of line, anything to do with that outdoor kind of exposure is going to get you marks here. As well, we've got exposure to chemicals, and it really, if we want to be specific and make sure we're guaranteed to get that point there, I'd be mentioning pesticides. We know that this is a person that works as a gardener, and so is almost certainly going to be handling those kinds of things. We'd be wanting to find out what he works with and what kind of protective measures are in place there, but certainly exposure to those things are known to be irritating to the respiratory tract. Now, something that I think often gets overlooked is, unless you live in somewhere that has extreme weather, is just the temperature of the air itself. We know that cold air is more likely to be irritating or to develop these kinds of symptoms than warm air is. And so certainly just exposure to cold air is going to make a difference. So definitely going to score you a mark there. All right. Now, of course, we have another question coming up. So let's get 2 minutes back on the clock, and your time starts now. All right, time up. And I don't know about you guys, but we have had a lot of these kinds of cases at my clinic recently, which is why I thought this would be a fantastic question for KFP preparation. So again, going back to environmental or occupational medicine, it's all about what kind of exposures does this person have. Now, of course, we have things like exposure to pollen or grass is a very, very common trigger. And so anything around that kind of line, anything to do with that outdoor kind of exposure is going to get you marks here. As well, we've got exposure to chemicals, and it really, if we want to be specific and make sure we're guaranteed to get that point there, I'd be mentioning pesticides. We know that this is a person that works as a gardener, and so is almost certainly going to be handling those kinds of things. We'd be wanting to find out what he works with and what kind of protective measures are in place there, but certainly exposure to those things are known to be irritating to the respiratory tract. Now, something that I think often gets overlooked is, unless you live in somewhere that has extreme weather, is just the temperature of the air itself. We know that cold air is more likely to be irritating or to develop these kinds of symptoms than warm air is. And so certainly just exposure to cold air is going to make a difference. So definitely going to score you a mark there. All right. Now, of course, we have another question coming up. So let's get 2 minutes back on the clock, and your time starts now. All right, so time is up. And let's get to the answers here. Now, the most likely thing based on this presentation here is going to be occupational asthma. So occupational asthma is the development of new onset of asthma or the recurrence of asthma due to the exposure specific to a workplace. It's the most common occupational lung disease in developed countries, and we think about 15% or so of all adult onset asthma is probably going to be occupational asthma. So that's certainly going to give you 2 marks there. If you were less specific, you're going to drop a mark there and probably just get the 1. Other things that can lead to this kind of presentation would be allergic rhinitis, would be high on that list there. And if you just put allergy, I think you're probably not being, you're not showing that level of consultant knowledge that this exam is really hoping to see here. And so I don't think you'd be getting any particular marks for that. Now, we don't have any information here about smoking history, but there's not really enough here, I think, with this picture to diagnose something like COPD, and so I'd be inclined to push away from those kinds of answers, particularly when we've got such other excellent things here and only 2 positions to fill. So that's where I would be putting my bets there. Of course, we've got more questions, so without further ado, let's put 2 minutes back on the clock, and your time starts now. All right, time is up for the final question on this case. And of course, when we're looking at this kind of patient here, we're in that kind of mild to moderate severity. He's symptomatic but not acutely unwell. The numbers are behaving themselves, but we're certainly finding some clinical findings here. Now, I've intentionally left it kind of in those between brackets to give you more different options you may be willing and able to try out. So, of course, these kinds of patients, the first thing we often try is that inhaled salbutamol or SABA group. Again, in the actual exam, I'd be avoiding any abbreviations, and so you'd be spelling out short-acting beta agonists. Now, you could also consider things like inhaled budesonide and formoterol. That would also be appropriate as a first-line trial. Oral antihistamine would certainly be worth a go, given we've got this trigger of exposure to pollen and grass. And, of course, if we're going down that allergic rhinitis pathway, intranasal corticosteroid trial would certainly be a valid option. And if you're wanting more information around these, I would certainly look at ETG, have fantastic sections for both asthma, adult onset asthma, and the Asthma Foundation Australia guidelines as well. ETG have a better summary, of course, for things like allergic rhinitis, as well as a handy little flowchart to kind of guide you down what kind of treatments could be appropriate in this setting. So if you haven't already, have a quiz there, and best of luck for your future study.